Hello, this is Dr. G with naturalfoodsdiet.org. You may not know this, but it appears that doctors and our healthcare system are actually hazardous to our health. An independent team of healthcare professionals, using the published research, found that doctors and allopathic healthcare cause 800,000 deaths a year in the United States. That would make it the leading cause of death. Now, the United States healthcare system is the worst of the worst. It's not only dangerous, it's also the most expensive in the world, slurping up $2.5 trillion a year. More is spent on healthcare in the United States than all the other countries of the earth combined. So that means that 4.5% of the population of the earth spends more healthcare dollars than the other 95.5%. So that must mean that the people in the United States have hogged all the health, right? Wrong. The United States is actually ranked 33rd in life expectancy and has the worst infant mortality rate of the 14 nations that have the most income. The United States rates poorly in most other health categories as well. So there you have it. We have an outrageously expensive and ineffective healthcare system. Now, as I see it, a big factor in our poor rating is our doctors' reliance on drugs and surgeries for treatment, rather than looking for the root cause of a problem. Now, why do you suppose the healthcare system is such a failure with these poor outcomes and runaway costs? Could part of the reason be that the average doctor has many loyalties that come before you, the patient? Now, her first loyalty must be to the state licensing boards. This board has the power to remove the provider's license to practice. Now, what criteria is used to revoke a license? Is it bad outcomes? Well, that's not really a problem as long as a doctor follows the standard of care. Now, with 800,000 people a year killed by their doctor, there's a heck of a lot of bad outcomes. So this really isn't likely to cause a problem. But if a physician tries something innovative, and this is regardless of the patient's outcome, they'll be at risk for being shut down by their medical board. A great example of this is portrayed in Brudzinski the movie. Watch this film if you want to see how the state medical boards operate and how persistent they can be despite this physician having great patient outcomes, and he had a safe and effective alternative cancer treatment. Now, your doctor's next loyalty is to his malpractice insurance company and the malpractice attorneys. Now, with all those dead bodies lying around, doctors get sued a lot. In fact, the average doctor faces a malpractice lawsuit every 7 years of practice. These lawsuits take up a lot of time, energy, and money. Now, the focus on the inevitable lawsuit causes the practice of defensive medicine, and that's do everything and run every test just in case. This is actually a very expensive and very dangerous way to practice medicine. That's for the patient. Now, it can actually be quite lucrative for the doctor because he's doing all these extra tests and procedures. The fear of lawsuits also leads to lying by physicians. No one wants to be sued. And I think it's normal to lie in order to avoid extreme pain. Now, the next loyalty of your doctor is to the health insurance company. This is the entity that pays the medical bill. And these companies have their own treatment algorithms, and they have quality rules. And if the physician doesn't follow them, she can get paid less or not at all, or maybe even get banned from the plan. And then there's the government. The government has written thousands of pages of rules and regulation that the physician must follow. If your doctor breaks the rules, it might constitute fraud or some other criminal offense, which can lead to expensive fines and even jail time. Now, doctors can also have loyalties to the drug and device companies, especially when they're given incentives or other bribes. And doctors can be bribed to look the other way or to accept biased and even fake studies that are done by the drug companies and even the learning institutions. Now, in addition, many doctors have an air of arrogance, and this is created by the medical establishment manipulating a physician shortage. And this is by limiting the number of physicians trained, and then by lobbying for laws to ban all alternative types of healing. This monopoly has led to greed and ethical laxity. So you can see that the patient might be the last thing on your doctor's mind. And that's a scary thought. Now, I want you to know, I'm not wholly blaming doctors, and I'm not saying doctors are bad people. They're trapped in a fatally flawed system. Now, I know firsthand the pressure that a physician faces. Now, I know I can't help my patients if I lose my license or if I get banned from the health insurance plan. Now, luckily, in 30 years of practice, I haven't been sued yet. And the other item is I don't want to lose too much weight. And if I miss the drug rep meals, I could, become really too skinny. Just kidding there. But why don't you check out naturalfoodsdiet.org? Here we have a free health program that can sidestep the sick care healthcare system. This is Dr. G. Thanks for watching.